Hey nurses, welcome back with me, Dany Imran. Topic 15, explanation of hemiplegia. What is hemiplegia? Hemiplegia, hemi-half plagia paralysis, as the name suggests, literally means paralysis of half of the body. If there is muscle weakness without paralysis, it is termed hemiparesis. Therefore, hemiplegia affects only one side of the body, usually affecting the arms and legs, but sometimes the symptoms can also involve the torso. Hemiplegia can occur suddenly or develop slowly. Spastic hemiplegia is a type of hemiplegia that causes muscle contractures, which results in loss of muscle control, chronic muscle pain, and aberrant movements. Hemiplegia is often associated with brain damage or head injury. Similar to other forms of paralysis, hemiplegia exhibits significant loss of sensation control in the affected parts of the body, which is often accompanied by intermittent pain. There are many causes towards hemiplegia. Firstly, there will be a brain injury. Traumatic brain injury on one side of the brain can give rise to hemiplegia on the other side of the body. And this brain injury can occur from road accidents, falls, violence, as well as other causes. The next cause is stroke. Hemiplegia can occur as a result of stroke, which is technically termed as cerebrovascular accident, CVA. Next is aneurysm and hemorrhage. The development of a brain aneurysm or a weakening and bulge of the atrial wall can be fatal, especially if it bursts. Moreover, brain hemorrhage can be equally devastating. Both of these conditions can cause hemiplegia. Next, infections. Brain infections such as meningitis and encephalitis are very serious and if untreated can result in hemiplegia. Next is the Brown-Sequat syndrome. This is a specific type of spinal cord injury that is named after Charles Edward Brown-Sequat, who first described the condition in 1850. It causes damage to one of the half of the spinal cord, resulting in paralysis. Next is demyelinating diseases, brain cancers, degenerative disease such as amyotrophic lateral sclerosis or Lou Gehrig's disease, and congenital diseases such as neonatal onset multisystem inflammatory disease, NOMID, or as very famously known, cerebral palsy. There are many signs and symptoms of hemiplegia. The major ones are such as loss of motor functions, loss of sensation, and in case of partial loss of sensation, there may be unusual sensations or tingling on the affected site, mental aberrations, you can see changes in cognition, mood, or perception, seizures or muscle spasms, because these attacks can severely debilitate the hemiplegic patient. Pusher syndrome as one of the signs, as this syndrome arises from traumatic brain injuries and cause a person of hemiplegia to shift their weight to the affected side. And also, we can notice speech and associated problems, as the hemiplegic patient can face difficulty in speaking, often manifesting as slurred speech. This is also accompanied by swallowing and breathing difficulties. How do you diagnose hemiplegia? Diagnosis of hemiplegia can be based on clinical evaluation and physical examination to test muscle strength and sensation. This will enable the doctor to clinically diagnose the patient. However, to pinpoint the exact cause of hemiplegia, some other tests can also be ordered, such as blood tests, computed tomography CT scan, magnetic resonance imaging MRI scan, electroencephalography EEG, and those are the ways on how to diagnose and pinpoint the exact cause of hemiplegia. How do you treat hemiplegia? Treatment of hemiplegia involves a very multi-pronged approach. Besides doctors, the role of physical therapists and occupational therapists is vital for regaining functionality of a hemiplegic patient. Some of the major strategies that can be adopted for treating patients with hemiplegia include the following, such as medicines. Medicines can be cured for treating symptoms as well as underlying causes, such as examples like drugs are used to treat the upper motor neuron syndrome, Librium as an example. Next step is neuromuscular electrical stimulations, or NMES and EMS, and surgery, but surgery only mainly focuses on treatment of secondary issues. This include involuntary muscle contractions, spinal damage, contractures, or damage to the ligaments and tendons. Next is alternative medicine. Alternative medicine such as Chinese medicine, acupuncture, and Unani medicine have been reported to be effective for the treatment of hemiplegia caused by stroke. And that's all on the explanation of hemiplegia. Thank you for watching. Dany and Mohd.